name's Melanie. I'm the CEO and co-founder of Acoma Health.
Hi, I'm Nee. I'm the CEO and co-founder of Acoma Health.
So Nee and I came together to build Acoma Health many months ago, really to tackle the problem we saw around accessing mental health care in Africa. First of all, we both had discussed this in the past, how hard we found it finding a therapist of our own with a similar background to us during the pandemic. And that's why we realized, actually, this is a big problem. We started out by interviewing other people around us in Nigeria to really understand the problem, which we weren't really sure if it was a problem of people just didn't want therapy. And we very quickly found that actually there was a huge need and huge demand for quality mental health care services. And we decided to work on this together.
Yeah, exactly. Quality is something that's super important to us and central to how we think about care. As Mani was saying, we spend a lot of time interviewing people, and there's so many stories about negative experiences that people had in therapy. So a big part of our job is making sure that everyone that comes onto Acoma Health can get appropriate care, but also quality care in a safe space, in an empathetic space. And what that means for us is that we spend a lot of time and are very choosy around who we onboard on the professional end, on the provider end rather, onto our platform. So yeah.
I would say one other thing that's really important to us is privacy. We've done a lot of work to ensure that we meet the highest quality standards. They call it HIPAA in the US. And we also ensured that we have providers, we call them providers, that's psychologists mostly, but also therapists, across borders that exist in Ghana, in Nigeria, and a few other countries too. So that if you don't want a therapist in Nigeria, you can have a therapist in another country too. And so that's a way to build trust with you or our users. And yeah.
Acoma Health is a web application now, so you can always sign up online, regardless of if you have an iPhone or an Android. For us, it was very important that people would be able to sign up really quickly as soon as they felt that they needed help or support. And so it was really important for us to remove the constraint of having to go into an app store, find space on your phone to download a new app on your phone. We wanted to make sure that accessibility was at the top of our agenda. So we're a web application. You can sign up. You can decide to be anonymous when you sign up, so you can hide your name, for example. So what that means is anybody you speak to inside the app will not have your real name, and you can feel confident that you're having a secure session with one of the providers in our app. But in terms of our product, we're kind of two-sided. On one side, it's the side that a user sees, so somebody signing up on Acoma Health looking to receive care. On there, as I was saying, you can sign up anonymously. You can choose which therapist that you speak to, and there are a lot of different factors you can weigh as you decide who you want to speak to. One is price, of course. You can read, the various bios of the therapist that you might speak to, and it was really important to us to give people the freedom in choosing who they would speak to and give people the right range of people that they could choose from, so that they could feel confident in their choice of a provider or a therapist. On the other side, as I was talking about, is the provider side. And we spend a lot of time, one, choosing who we even decide to start interviewing, putting them through an interview process, and then onboarding them onto our app. Typically, we do a very quick introduction to our app, and we make sure they're comfortable using our app, and they're basically ready to start providing care on Acoma Health.
So our customers are B2C and B2B. And so we do have direct channels for people like me, and I can go straight to this website to book a session. But we also cater to employers for their employees to be able to access care, to deal with the stressful work environment, to deal with absenteeism, and many other issues that exist in the workplace. We also deal with hospitals, especially with their inpatient experience. And we also deal with insurers, health insurers too, to provide therapy to their members, because more times than not, in an African context, a lot of these insurers actually do not adequately cover mental health care. And we hope to expand to many other forms of institutions as well, universities and so on in the near future. So if we're also taking recommendations for institutions as well. So Acoma Health exists across multiple African countries, including Nigeria, Ghana, Zimbabwe, Kenya, and many more. That means our providers are in many of these countries, but it also means that our users are in many of those countries. Just given that it's a website, you can actually log in from anywhere. You could be in the US, you could be in the UK. We also want to cater for the diaspora market. I know many people in the US that are of, let's just say, Colombian heritage who use their Colombian therapist as well as their American therapist, or either or. And we want our African diaspora to have a similar experience where there's culturally conscious care available to them when they need it, to deal with specific issues that are really specific to our own experience as Africans, be it children of immigrants yourself, certain cultural ties or nuances that exist within the realm of what we can and can't do to lead to our therapeutic outcomes. Maybe that sounds abstract, but we can get more specific. But yeah, we're everywhere for you if you're African or if you feel that you want an African therapist.
So if you're looking for support, or if you know anybody else that's looking for support, or if you want support to be provided to you through your employer, your insurer, any other institution, please feel free to reach out to us. But more importantly, you can get the care, you can get someone else's care on akomahealth.io. Feel free to sign up, sign in, and start getting the care that you deserve.